large advertising platforms, Meta, Google, Amazon, they all have severe restrictions on anything broadly to do with women's health. And all of these human reviews kept coming back saying, yes, your tampon is contraception, so therefore you can't advertise it. So there's a fundamental lack of understanding of how, the female body works.
Welcome to the conversation. In today's episode of Trailblazers, Johnny is speaking to Valentina Milanova, founder and CEO of Daye. Daye is a gynae health startup on a mission to close the gender health gap for good. We hope you enjoy this episode. Be sure to subscribe and follow us on social.
Valentina, it's an absolute pleasure to have you with us today. How are you doing?
I'm really well. Thank you for having me. Excited to be on.
Tell us a little bit more about yourself and your journey to where you are now.
Yeah, so I'm the founder of Daye. We are a platform for gynecological health management. The reason why I started the company is because I've personally struggled with a variety of women's health problems, which I didn't feel were being adequately addressed or taken seriously. And initially, when I was growing up, I thought that my experiences were unique and that I just had really bad luck. But then through conversations with my peers and my friends, I realized that the issue is systemic. And today I still feel that one of the biggest problems we can solve for within our lifetime is gynecological health, so that we can enable, over half of the population to participate in the economy, in society, in sports and education at the same level as everyone else. But unfortunately today, women still face a lot of physiological limitations because healthcare doesn't serve us in the same way that it does the male physiology.
Yeah. What was one of the first experiences that you had with kind of your journey and that kind of really started to make you aware that this is something that really needed tackling?
Yeah. So I had my first period at the time that was considered young at the time. So I was 9. That was 20 years ago. Now women and girls are starting their menstrual cycles younger and younger. So the average age in some parts of the UK is now 8 years old. However, because we don't have a lot of comprehensive gynecological health or menstrual health education in schools, a lot of girls still think that they're dying when they get their first period. And that was my experience as well. I thought I had contracted some kind of a disease, and I felt very ashamed. I didn't want to tell my parents. I didn't want to tell a teacher. And I actually hid my first period for a year from my parents. I didn't tell anyone what was going on. And again, similarly to my other women's health experiences, through conversations with my friends and my peers, I realized, wow, this is not an unusual experience. There's actually a whole phenomenon that's recorded and well observed in medical literature, that girls assume they're dying when they get their first period because we so rarely talk about the menstrual cycle. And we tend to delay these conversations to a much later time versus the time that people are now starting their first menstrual bleed at.
Based on your experience and the knowledge that you've now developed over your career on this pathway, what are some of the most surprising questions or the common questions that you get that surprise you?
I think some of the most common misconceptions about women's health that we really need to spread more information on and shed a light on. So first, women were not allowed to participate in clinical trials up until 1993 in the US and 1995 in the UK. So for the majority of medications that we rely on today, we have very little information about how they affect the female versus the male physiology. So for a long time, there was this scientific misconception that women are just smaller men. So we didn't fully account for the physiological differences between the two sexes. And still to this day, we do struggle with recruiting female participants to clinical research at the same rate at which we recruit male participants, because we have the infrastructure in place for recruiting male participants, but it hasn't been adapted to female participants. So what this means is that when we're developing a new medical device, a new pharmaceutical, we still know very little about how it affects the female physiology. And this is strangely also the case when we look at medications that are specifically designed for women. So for example, when they were conducting safety tests on the female Viagra, about 92% of the patients that were recruited for this investigation were male, even though the female Viagra is supposed to be for women exclusively. And another key example of the gender health gap is the gender gap in diagnostics. So a recent study from 2019 from the University of Copenhagen in Denmark. And keep in mind that Denmark has some of the highest levels of gender parity anywhere in the world in healthcare outcomes. Yet still, across 700 diseases in Denmark, women got diagnosed significantly later than men. So for cancer, it was about 3.5 years later. For diabetes, it was about 4.5 years later. This is a significant delay in which the patient is not receiving treatment. Their experience is not being validated, so therefore it can progress, it can become worse. And when we look at the gender diagnostic gap in female-specific conditions, it's even deeper. In the past few years, we've learned more about endometriosis, we've learned more about polycystic ovarian syndrome, which are very common conditions for women. So they're more common than asthma and diabetes, for example. But we still face an 8 to 12 year delay in the diagnosis.
Yeah, I mean, the endometriosis diagnosis delay is absolutely insane. It's something that my wife has experienced, and other friends of mine have gone through. I think the average in the UK is about 11 years. It's something insane like that, which just becomes at a certain point, is this how it's supposed to be? Becomes the question. You feel gaslit when you kind of go into your GP and talk about these things. What would you like to see more effort made in terms of like education around these areas and these topics?
Yeah, we certainly need a lot more resources for our general practitioners, especially in the UK, where it's your general practitioner that's your first point of call for any gynecological health issues that you might be experiencing, whether it's contraception or your pap smear or endometriosis diagnosis. You're first referred to your GP. And GPs today, they simply don't get enough training and they don't get enough resources in order to be able to better support their patients. And for PCOS and for endometriosis in particular, so PCOS, polycystic ovarian syndrome, affects 1 in 4 women, and endometriosis affects 1 in 10 women. But the clinical diagnosis guidelines that we have right now, we have these clinically validated questionnaires like the Ludwig scale and the Mankowski pain scale. They're very hard for an untrained patient to comprehend, especially when we're talking about subjective experiences. So how heavy is your menstrual bleeding? How painful is your period pain? So we need a lot more solutions that bridge the knowledge gap between the patient and the GP or the consultant, the specialist, that enable the GP to triage the patient much faster, but also for the patient to be able to fully relay the nuance of their experience. Because that's often where we see the main causes of the gender diagnostic gap is, the GP doesn't have enough time. They have 8 to 10 minutes per consultation. They have to relay a lot of really complicated information to a relatively uneducated patient. And then the patient is put under the spotlight, right? They have to all of a sudden in the moment remember years of their medical history, years of their symptom history. So we really need tools that help bridge the gap between the knowledge of the provider and the understanding of the patient.
Yeah, I mean, why do you think it's taken such a long time for us to be meaningfully and proactively engaging in women's health now? I mean, the other question is really how seriously is that actually being taken now? There's a sort of assumption on my part that it is actually being looked at proactively.
Yeah, I don't think that women's health is getting the attention that it needs. There are improvements. We're having more conversations about women's health. So I don't think you and I would have been having this conversation on a podcast even 10 years ago. So that's an upside. But when we look at other data, such as the percentage of public funding that goes to gynecological health, the number of women that are on a gynecological health screening waiting list, the overall quality of care that's being provided in the UK for female patients, those metrics tend to paint a different picture. So we still see a very small percentage of the overall public budget for healthcare being deployed specifically to female health conditions. In the UK, it's 2.4%. So 2.4% of the entire pot of funding that's available for healthcare research, only that percentage is deployed towards women's health. The RCOG recently published data, the Royal College of Obstetricians and Gynecologists recently published data that across the UK right now there are 700,000 women on a gynecological health screening waiting list. So clearly the NHS doesn't have the resources that it needs in order to provide patient care. And more recently, the CQC, the Care and Quality Commission, has been under scrutiny for the general auditing services that it has been providing for healthcare practitioners in the UK, but very specifically for the poor quality of care that women are receiving. So I think women's health right now is a more popular topic of conversation, and that's the first step, and that's an important step. But we need to be honest with ourselves about where we are when it comes to actually delivering tangible improvements to healthcare outcomes. And we're nowhere where we need to be, and some of the important statistics are actually going down versus going forward.
What are some of the changes that you would like to see made, and what do you think could be meaningful steps that could be taken to tackle some of these challenges?
So this might be slightly controversial because I'm Bulgarian. I'm not British. I have been living in the UK for the past 11 years, but I wasn't born in the UK. So I have a slightly different perspective. I know the NHS is this country's religion, or as close as it gets. And this means that open conversations and debates around how the NHS could work better tend to be very challenging because they become very emotional very quickly. But I don't think that the NHS is able to solve this challenge by itself. I think the NHS, we need to be a bit more open-minded about the NHS partnering with private healthcare providers. And I know that this is a particularly controversial topic because whenever the NHS has tried to partner with public providers, that hasn't necessarily worked. But in the context, in the broader economic context of the UK, where we see economic stagnation, we see the level of public indebtedness rising. There isn't an appetite for us to increase the taxes of the general population. There simply isn't another way in which we're going to come up with the funding and the resources needed for the huge system-wide change that we need in order to solve for gynecological health conditions and in order to enable women to fully participate in the economy and in societies. So the new Labour government speaks about growth, economic growth and development very frequently. And I think one of the key ways in which we can enable that is by enabling women to participate in the workforce. And another statistic that I like to highlight is that in the UK, there are 1 million working women who are at risk of leaving their jobs, leaving their profession, because their menopause or perimenopause symptoms are not adequately addressed. So this is a huge potential driver of growth for the economy that might leave the workforce because their physiological needs are not being addressed. So I do think that one of the key answers is for us to find ways to vet private companies in a really diligent and detailed way, but there also needs to be a mindset shift. So I was watching all of the debates that were happening between Labour and the Conservatives in the pre-election period, and one of the things that Keir Starmer mentioned is that he wouldn't go private for his healthcare needs, even if he was seriously ill or if one of his family members were seriously ill. And I was quite surprised to hear that because in other debates that he's been in, I've been stricken by how pragmatic he is. He tends to have a very pragmatic, non-dogmatic approach to the majority of policy questions. But when it comes to healthcare and when it comes to the NHS in particular, I think we are limited by these preset notions and ideological views, which in my experience seem to be somewhat unrealistic.
Yeah, I would agree with that. I remember being struck by that same thought when he mentioned it in the debate with Rishi Sunak. And unfortunately, it rather harshly on my side rang false, I would say. If he were fully aware of the situation as it stands in the NHS and his child got ill, there's absolutely no way that a parent wouldn't move heaven and earth for their child.
Yeah.
And I think anyone who knows a little bit about the state of the NHS would feel the same. Do you think that there is a bit of a role? I'm trying to broaden the awareness and the horizon here. Do you think there's a role that kind of men can more proactively play in their education, their understanding as well and what does that look like without kind of, being too heavy-handed with these things, but actually engaging in a helpful way? What can men do as well here?
Yeah, I'm so happy to hear you ask this question because I think that's an essential part of the recipe that we need to implement in order for women's health to get the attention that it deserves. Women's health is human health, and we should all be involved in it, and we should all be pushing it forward because everyone has a sister or a mother or a friend or a spouse in their life that they care about. And vice versa, women tend to know a lot about say prostate cancer, a condition that's very male dominated, and we participate in fundraisers for prostate cancer, and we support Movember, etc. So why can't we do the same for women's health? There's just and I see that a lot in my fundraising conversations, because Daye is a company that's backed by venture capital. The majority of venture capital investors are men. And one of my biggest fundraising challenges is that men still feel fundamentally uncomfortable with any conversation or debate about gynecological health. So when I have to go into a room and present my business, I can't really do that without talking about vaginal health or about menstruation or the vaginal canal, which is where our main products, the tampons, go in. And I see just the posture changes. People kind of wrap their arms around their body. They look down. They try to avoid eye contact. And I just get the sense that they can't wait to have me out of the room so they can be relieved from the discomfort of talking about gynecological health. And that will only change if we start to normalize these conversations. And I do now have male investors. I have male board members. And it's been one of the most interesting experiences of my life to see how they've changed, in the years of working with Daye, how they themselves have become so much more comfortable talking about reproductive health. And now they speak about women's health to their other, male investor peers or to the other partners in the fund. So yeah, I think it can be a really exciting thing. I see a similar thing with the employees of Daye. So people frequently assume that we're an all-female company because we work in women's health, but we actually have a pretty equal balance between the two sexes. And initially when we bring in a new male employee, I can see they might be a bit uncomfortable with the subject matter, but then gradually they become an expert. And when they go to social events and parties and bars, they talk about tampons and menstruation. And it's a beautiful thing to witness. Women's health should be a universal topic.
I completely agree. And this actually reminded me of a situation where I won't mention any specifics around the brand or anything like that, but there was a chocolate company that my wife was working with, and they had launched a period egg. And the owner of the brand got very uncomfortable when my wife was talking to them. Older gentleman who was like, "Oh, it's just," you could see as she was talking to him, his posture was shifting. He was shuffling his feet, and that strikes me as this is something that is so natural, and it's an indicator of a healthy body, that your period is something that you go through on a monthly basis. And yet the level of comfort that people feel talking about it really does. You see them, the awkwardness take hold. We really do need to shift that. We need to get to a place where this is something that people can talk about more openly and more comfortably with. I know that you've had some challenges in this space with some of your advertising stuff. So obviously I've seen on LinkedIn and stuff like that. How do we shift this? Because this, having words covered up on an advertising billboard that are perfectly natural bodily parts, that are functioning parts of your anatomy, this just seems crazy.
Yeah, so for your listeners and your viewers who might not be aware of this, one of the biggest issues in women's health today is that large advertising platforms, whether they be Transport for London or Meta, Google, Amazon, TikTok, they all have severe restrictions on any mention on anything broadly to do with women's health, whether it's menopause or breastfeeding or pelvic floor health. Whenever you try and advertise a subject matter related to these conditions or a product related to these conditions, your content frequently gets categorized as sexual content, adult content, political content, or in another category, and just is deemed inappropriate, which it's an industry-wide issue. It's a huge problem, and I just don't see how it will be resolved before the women's health becomes bigger and we can lobby for ourselves more effectively. We at Daye, we've been facing this problem since 2019, and it's not just an issue in the moment where you can't show an ad or you have an out-of-home ad and it gets censored by members of the public. Every time you have on Meta and Google, one of your ads get restricted or taken off unfairly, the quality of your account gets downgraded, which means that for any future ad, you can show it to fewer and fewer people. And also, if you've had too many ads get blocked and get restricted, then all of the learnings on your account get wiped. So there's an economic penalty there that's quite significant, because you deploy funding every month towards Meta, towards Google, towards TikTok, to train their algorithms on which ad, which creative they should show to which audience. And they have the power, if they decide that your ad is adult content or political content, to also wipe the learnings from your account. So that's a huge economic penalty, not just in the sense of lost revenue, but in the sense of an actual lost investment. And it's an ongoing issue. So it's something that we experience every single week, a day, whenever we try to advertise our products. We're currently in a big fight, I would say, with Google, because they are categorizing our tampon ads as contraception. So first of all, why are you not allowed to advertise contraception on Google? What's wrong with contraception? But it's against their policies to advertise contraception. Second of all, no one in the history of time has ever used a tampon as a contraceptive. And initially, this was their AI engine that wrongly classified our ad as contraception. Then we requested human reviews, and another human review, and another human review. And all of these human reviews kept coming back saying, yes, your tampon is contraception, so therefore you can't advertise it. So there's a fundamental lack of understanding of how, the female body works, how medical devices for gynecological health work. And this is one of the biggest blockers for growth for women's health businesses. So first, you have to overcome the fundraising challenge, because it's very hard for women-led companies and female health companies to raise funding. Then you have to overcome the data challenge. So you have to design your own clinical trials. You have to run your own clinical trials, because there's very little pre-existing data that you can rely on. And then if you're able to go through the fundraising challenge, the data challenge, and you have a product that works well and you want to advertise it to people who need your solution, then you have this whole other roadblock of not being able to advertise on any channels, on digital channels, on physical channels. It's a huge issue.
Goodness me. I mean, I've learned an awful lot from you in just the last couple of minutes about the challenge that you're facing, because, I mean, that is absolutely bananas. I never realized that it was quite that bad, that a tampon would be classed as a contraceptive device. And, when you mentioned earlier about the 2.3%, of health tech funding in the UK going towards women's health, I previously thought that was 4%, which is already bad enough, but I didn't realize it was even less. And I know that it's only 1% in the US as well, which is, even more crazy. Obviously, you've got an array of diagnostic products as well that you mentioned earlier, giving those GPs, giving those doctors as much knowledge as possible, or as many waymarkers as possible to help diagnosis with various different conditions. How much time, from your kind of experience and benefit, have these tools been able to kind of yield, and how important going forward do you think they're going to be in women engaging with their gynae journey more proactively?
Yeah, so we have two diagnostic tools that help GPs save time and help female patients get access to the answers that they need on their women's health questions. The first one is our period and pelvic pain clinic, which is a triaging tool that helps you get diagnosed with the root cause of your period and pelvic pain faster. And then we build a personalized pain management plan that's tailored to the needs of every individual patient. And we're currently piloting the service with the NHS. So different NHS trusts spend different amount of money on their 8 to 10 minute GP consultations, but they tend to be quite costly. So anywhere between 40 to 90 pounds for that consultation. That's the NHS cost. By comparison, the period and pelvic pain clinic is as affordable as £5. Most GPs are the first point of call for period and pelvic pain. Most GPs don't have the time to stay up to date on all of the latest diagnostic guidelines, clinical guidelines, and treatment guidelines when it comes to period and pelvic pain. So what we hope to do with the period and pelvic pain clinic is save the NHS money, time, and resources, but also to improve the quality of care by providing a more specialist solution to this very, unique need around period and pelvic pain. Because we know that, just giving over-the-counter painkillers, just prescribing hormonal contraception is not the answer. And that's where the GP's resources typically end at, have you tried ibuprofen? Would you like to go on the pill when it comes to period and pelvic pain? The second solution that we have is the diagnostic tampon, which you can use for STI, but also for HPV screening, human papillomavirus. I'm very excited about what we can do within our lifetime. We have the actual tangible opportunity to entirely eradicate a type of cancer within our lifetime, and that's cervical cancer. Cervical cancer is the fourth deadliest female cancer in the UK and the second deadliest female cancer on a global scale. And through a combination of regular screening and vaccination programs, we're able to completely cancel this type of cancer. Currently, the NHS, especially post-COVID, we have an issue in the NHS, which is that people don't attend their pap smear appointments. They find them too intimidating, or they can't find the time in the day to go for their screening appointment. So what we've developed with Diagnostic Tampon is a highly reliable, very sensitive, very specific method for women from the comfort of their home to obtain a sample from their cervix, from their vaginal canal, with a tool that they're already familiar with. So with a tool that they already know they've probably used at least once in their life. And cervical cancer screenings are expensive and time-consuming for the NHS, but cervical cancer treatments are even more expensive and time-consuming for the NHS. So I'm excited about what we can do to reduce waiting times and reduce healthcare costs with the diagnostic tampon as well.
Yeah, I mean, that's absolutely huge. My next question was going to be about what the future of this potentially looks like. Are you going to, these sound like amazing tools that could even extend to potentially clinical trials and opportunities to increase the ability for women to participate in clinical trials for medications. As you mentioned earlier, we always do tend to treat women just like smaller men. And the amount of adverse and often dire events that occur, could be mitigated massively, and particularly with tools like this.
Yeah, so all of our products and services, they've been through randomized controlled clinical trials so that we could compare against the current clinical golden standard, whether that's in period and pelvic pain or in STI and HPV screening. And we collect all of our clinical trial data, we de-identify it, and we store it in a medical database, which we then make available to different researchers across the UK. So we partner with researchers from Liverpool Women's Hospital, which is the largest women's health hospital in the UK. We make this data available to them pro bono, so that they can use it to publish scientific publications that other scientists and researchers can then see, and so that we can finally answer some of medicine's questions on what causes gynecological disease, how best to treat gynecological disease. And one of the areas that I'm very excited about that's now gaining more recognition is the role that the vaginal microbiome plays in a variety of reproductive health functions, from your risk of STIs, your risk of vaginal infections, but it also plays a role in fertility, in miscarriage, in the success and likelihood of IVF outcomes, etc. So we're now partnering with a number of different researchers on how can we harness this data on the vaginal microbiome in order to better diagnose gynecological disease. And what I want us to start working on next is how can we use lactobacilli-based therapies. So lactobacilli are the good bacteria in the vaginal environment. How can we synthesize specific strain of lactobacilli that can be effective against different pathogens that are found in the vaginal environment, whether those be yeast infections, bacterial vaginosis infections, mycoplasmas and ureaplasmas, etc., because the way in which we treat vaginal infections today really fails women. So the treatment that you get for your vaginal infection destroys all bacteria, good and bad, in your vaginal environment indiscriminately, which leaves you more prone to a second, third, fourth, etc. infection. And that's why we see a big percentage of the general patient population experiencing recurrent vaginal infections, which can be incredibly distressing. So every woman who experiences at least one vaginal infection in her lifetime, and they're deeply stigmatized. We don't talk about them. I always find it very curious that we would never be ashamed to tell someone that we have, like a snuffy nose or a throat infection, but you wouldn't dare mention your vaginal infection, even to your female friends. They're so deeply stigmatized. And having a vaginal infection, means you experience burning and itching, painful sex, etc. So they do have a big impact on the quality of life. And I'm excited about what we can do with lactobacilli-based therapies to enhance the health of the vaginal microbiome and treat specific pathogens without reducing the overall levels of good lactobacilli. One of the things that I was completely shocked by when we commercialized our diagnostic tampon for vaginal microbiome screening, we kept seeing patients that have zero lactobacilli, no lactobacilli whatsoever. They have no good bacteria in their vaginal environment because they've been prescribed antibiotics, they've been prescribed antifungals, and they've wiped away the good bacteria from their vaginal environment. And we're only now beginning to recognize what this means for miscarriage, for preterm labor, for recurrent vaginal infections, etc.
Being pragmatic about that, like on a short, medium, and long-term time horizon, what are some of the changes that you'd like to see kind of like happening in that space to make a difference?
Well, one of the specific changes, and this might be too specific, but it's another example, I believe, of the gender health gap. So there's a pathogen called ureaplasma, which can be sexually transmitted. It's recognized as an STI in men, but it's not recognized as an STI in women. It's the same underlying pathogen, but it's not recognized as an STI in women. So what we see in our patient populations is that we get, patients who have vaginal symptoms. So they have unusual discharge, burning, itching, discomfort, but they only get tested for bacteriovaginosis or candida. They test negative for bacteriovaginosis or candida, yet they're still prescribed antifungals and antibiotics, which will not be effective for the underlying pathogen. And they eventually at some point get screened for ureaplasma, but they can't get treatments for ureaplasma because in the UK, ureaplasma is only recognized as an STI in men, not as an STI in women. And I think that's a very, practical, specific change. So the question about antimicrobial resistance is a very serious one that I personally take very seriously. So we shouldn't be prescribing antibiotics, carelessly. But if someone has symptoms that have lasted, for a prolonged period of time and they've tested positive for ureaplasma, it makes more sense that we would treat them for ureaplasma rather than for a condition that they don't have. And, beyond this, I wish we could have more open conversations about vaginal health without, the stigma that they currently hold. I think the space of erectile dysfunction is a good example. Erectile dysfunction used to be such a huge taboo topic. No one would bring it up. And then Viagra came about and people started feeling more comfortable discussing it. And then now there's this third wave movement of don't only rely on Viagra, try and address the underlying, perhaps, physiological or psychological issue that you might have. And I hope we go through a similar, change in vaginal health where it's now very stigmatized. Hopefully we'll soon have better treatments. And after that, we can start having a more holistic approach to vaginal health as well.
Yeah, 100%. What does the immediate future and longer term future look like for Daye? Obviously you've mentioned some of the things that you're working on at the moment, and it sounds like you've got some significant challenges ahead, but what are you most excited about?
I'm most excited about the potential of eradicating cervical cancer. And you mentioned about, different ways in which men can get involved in the conversation around women's health. So a common misconception is that men can't get the HPV vaccine. They can. So boys are now being offered the HPV vaccine in different parts of the UK in school. But as a man, you can get the HPV vaccine up to age 46 privately. So the NHS doesn't cover it, but you can get it privately. And that's important because we need herd immunity to entirely eradicate cervical cancer. So HPV is also a sexually transmitted infection. We don't currently have a test for HPV in men, so men can't get tested to confirm whether they have it or not, but they can pass it on to women, with the potential consequence of cervical cancer. So, cervical cancer is such an unnecessary disease with the technology that we have available to us. And I really hope we take full opportunity of the scientific discoveries from the past decade, which will enable us to eradicate cervical cancer.
Yeah, amen to that. It's something that we actually have experience with. We worked on the campaign for Gardasil 9, which is the HPV
great.
vaccination, which was then being rolled out to boys as well as girls. So we worked on the campaign with that and did some work with Dr. Pixie McKenna on getting some of that information out as well.
That's amazing.
Which is, I completely agree with you. There's absolutely no excuse. Like, men can go and get that vaccination as well, and help. If people want to find out more, where can they go? Where should they look you up? How can they engage with the mission that you're on and the work that you're doing?
Yeah, so the only social media I personally have is LinkedIn, because I simply don't have the capacity or the mind space to maintain more than one. And then everything to do with Daye, we are on YOURDAYE, your Daye with an E.com. And on our website, on our social media platforms, we produce a lot of free gynecological health content that's always reviewed by a medical professional and confirmed for its scientific accuracy. So if you have a question about anything to do with reproductive health and want, digestible, illustrated answers, we've probably covered it in one of our publications.
Incredible. And if you could leave our audience with just one thought from today, what would it be?
So the conversation around, female participation in the economy, female entrepreneurship, women's health can often leave you feeling a bit depressed and overwhelmed because of the breadth of challenges that we have ahead of us. And despite the challenges, and it's important that we recognize them, there's still a lot of good work that is going on. And we're moving in the right direction. We just need to keep at it, stick to the road. It's a challenging road, but it's a non-negotiable. We need to provide better healthcare solutions to women and AFAB folks across the UK.
Amazing. Valentina, I'm incredibly grateful to you and the work that you're doing. And thank you so much for today. It's been absolutely wonderful talking to you.
Thank you so much.